Welcome to the Valley Wellness Podcast. Super excited here with Jen today. We're talking about a topic that to me is super, super important. Like I really feel passionate about this one. We're talking about cardiovascular disease or heart disease, which I'm sure everyone's heard or talked a little bit about it. But I'm excited to dig into it a little bit today, talk about some of the testing associated with it, some of the treatments that are effective for helping to reduce your risk of cardiovascular disease, and just kind of dig into the fact that this is not just a simple little problem.
And
we're dealing with.
hopefully, you're very passionate about this and very
Yes.
aware. And hopefully after talking about this, everybody realizes that they should all be very passionate
Yes.
about this.
Yes. So let's get into it. So I'll start with the question: why do we need to talk about heart disease?
Well, heart disease is the leading cause of death worldwide.
Both men and women.
Both men and women, but 7 to 10 years earlier for men.
Yes. Average age 65.
Yeah,
for men.
and
For their
decreasing
first
with
heart
time.
attack.
Yeah,
Yeah.
becoming more and more of a problem at earlier and earlier ages.
I think somewhere around a third of women are dying of heart disease right now, and I think 25% of men. So both kind of in that 1 out of 3, 1 to 4 range. And I think the scary thing is often it presents with a heart attack. It's
Yeah.
not like you have a symptom before something catastrophic happens.
I think the statistic is around 40% of people present their first presenting symptom for coronary artery disease is sudden death.
Yeah, that's a pretty heavy situation. I mean, this for me, it's pretty personal. My father passed away from a heart attack a little over 5 years ago, and we played golf together the week before, and he was fine. A week later, he was gone.
Yeah, and I think it's people, until they have it happen in their life, they don't realize how often it happens and is deadly in people that we kind of thought were doing pretty good with their health.
Yeah. I mean, he was pretty active. He was in his 70s, but very active. Traveled. He loved to, be at everything that his grandkids were at. And, this was right before my second child graduated from high school. And he would have loved being at that. And he wasn't, because he had a heart attack. So this is a topic that if I could have bought my dad 10 more years by having some preventative strategies, having some things that he did, that would have meant the world to me.
Some early diagnosis.
Yeah. I think we look at heart disease as this disease of old age. And granted, like I said, the first presentation in men is usually around 65. For women, it's somewhere in the 72 range. So I think people are like, oh, I won't have it until I'm in my 70s. Well, the hard part is it's not something that just happened when you're 72.
No.
It's something that a lifetime built to that moment. So if you want to have an impact on when that happens, we have to start talking about it
very
a lot
early.
earlier.
Yeah. And when I thought it was interesting, researching the pathophysiology of ASCVD, atherosclerotic cardiovascular disease, which I hope to never say again in this podcast. We're just going to call it ASCVD, right? Is that it starts when you're children.
Yeah.
Now pediatric populations they're encouraging them to do lipid panels on. Because we know that the beginnings of the disease process start when we are quite young, and it is reversible when it is recognized when we're very young.
Yeah, I agree. And just to maybe clarify what we think heart disease is basically heart disease is you've got blood vessels in your heart that help the heart muscle function. And with heart disease, you're developing plaques that narrow and narrow and narrow, and then can break off and block one of those blood vessels that feeds the actual muscle of the heart, and then it can't function.
There's oxygen deprivation.
Right. And so once the heart can't function or doesn't get oxygen, that's when people die.
And that happens really slowly over a long period of time because the vascular system What I think is interesting too is that there are so many different causes of
Right,
this
right.
that, what I think people focus on cholesterol.
Yeah.
Period, the end. And there are so many different causes. We have this very complex vascular system in our body, and it's lined with this single cell layer, the endothelium.
Mhm.
We want the vascular system and the endothelium to be smooth and slippery and elastic to be able to expand and contract with stress. And over periods of time, with insults to that endothelium, it gets stenotic and it gets damaged and porous, and then it allows these circulating lipids to deposit in those damaged portions, and it slowly accumulates in the form of plaque over a period of time and then becomes calcified, which is this more advanced form of calcifications. But it's those plaques that will suddenly rupture and get loose in the vascular system that will cause heart attacks and strokes. But it is this slow occlusion over a long period of time as a result of many different things.
That's exactly right. And, I think um, one of the hard parts is, we talk about cholesterol, but there are a lot of things that impact
Mhm.
whether that's going to happen. And scientifically, I think we're learning more about what those things are. But we do know there are some specific things in life that are going to increase your risk of having heart disease or having a heart attack as you age. And so let's ask that question. Like, what are some of the things that are going to put you at a higher risk of heart disease that we know of, that we've kind of heard? And
Yeah. So I think one of the most basic ones that we should look at, just because it influences so many different aspects of our health, is metabolic dysfunction. So unstable glucose patterns and elevated insulin levels. So eating refined foods, refined grains and sugars, and what that does to our blood sugars. And anytime there's an enormous amount of excess glucose circulating in our system, or insulin, that excess glucose is glycating that endothelium, and it's causing damage and inflammation. And insulin is also a signaling molecule that signals our liver to create more lipids. And so making sure that you're eating healthy and you're being metabolically healthy is one of the primary ways that you can prevent cardiovascular disease.
yeah, I mean, metabolic syndrome feels like an epidemic in this
Yes.
country right now.
Doesn't just feel. I mean,
It's a problem.
it's a problem.
And
It's
so
rampant.
when we talk about insulin resistance,
Hmm.
and having higher and higher levels of insulin,
Hmm.
it's affecting, a lot of parts of your body. Obviously, it's a really big risk for heart disease, but it's affecting a lot of things. We're having trouble with infertility.
Hmm.
We're
Dementia.
Mental health is absolutely
Yep.
affected by it. So creating higher rates of dementia, Alzheimer's.
You're also
Um,
more likely to get and die from cancer.
yes. Plus, I think you don't feel well.
Yes. Yeah, which is where a lot of the mental health issues come in.
Right. Right.
It feels terrible. It affects every aspect of your life. But today specifically, we talk about its impact on cardiovascular disease.
Exactly.
So it is a very kind of baseline foundational cause of damage to that endothelial layer in the vascular system, and signals the production of inflammatory markers and lipid synthesis in the liver.
What about sleep?
Mm. Sleep is one of those things that also, and so this is part of the 5 pillars, right?
It
These
is.
are the
It
things that
is.
influence our health in every way. We could talk about any aspect of health. We could talk about, dementia risk. We could talk about any disease and come back to these 5 things and find a way that these 5 things influence the risk factor for that. So sleep is this time when your vascular system in your heart gets to rest and reset
And
and
gets to heal.
and heal and
Yeah.
reduce inflammation. And this is true for every organ in your body.
Mhm.
And when we're not getting enough sleep, it increases our stress hormones. And we'll talk about stress hormones too in just a second, I think.
Yes.
But getting poor sleep or sleep apnea, which is these sudden episodes of oxygen
Mhm.
deprivation, which results in these stress hormone jumps
Pulses. Yeah.
and pulses, and increases the inflammation on our vascular system. Sleep deprivation is a huge cause of
Yeah.
cardiovascular disease.
And an interesting thing is, kind of what you talked about, everything is this like on this line of, a little bit's bad, little worse
Yes.
is bad. And then you get to a point and it becomes really detrimental.
Yeah.
They did a really interesting study on nurses where they measured their sleep. And the nurses who got less than 5 hours of sleep, it was like smoking 2 packs of cigarette a day for their increase in cardiovascular disease risk.
Yeah.
That is a tremendous risk. That's like almost a 4 times increased risk of cardiovascular disease if you're getting less than 5 hours. So, when you look at the actual data, between 7 and 5, there's a little increased risk. So if you're getting 7 hours to 5 hours of sleep at night, there was a little increased risk, somewhere in the 20 to 40% range. Once you dropped below 5 hours, it was like dropping off a cliff. It was pretty
It
amazing
skyrockets.
how bad that was. You know, one of the craziest studies they did I think it was in a Michigan hospital system, they actually looked at just daylight savings time and that switch in the spring of 1 hour. And they had that week after the switch, a 24% increase in cardiovascular events.
Yes.
In just that week.
I heard that. Oh,
in 1 hour.
I have been a fan of getting rid of that for so long.
I think we all are.
Nobody cares.
I think we all are. And the converse side is they actually saw a decreased risk of about 19% on the other
other side?
Yeah, when people got another extra hour of sleep. So I would have to say sleep is a pretty huge impact on cardiovascular disease. But since you brought up stress, hormones and stress, what would you say stress, how that impacts her risk for cardiovascular
and stress
disease?
is one of the biggest things that I talk about with my patients because we live in such a high stress society now. Our body has really good protective mechanisms in place for when we encounter danger. And a stress response, whether it's just because we have anxiety or because we've overloaded ourselves with responsibility, it initiates the same response in our body. So our vascular system becomes more tense, our blood pressure goes up, we increase the production of endogenous catecholamines like epinephrine and norepinephrine. We activate the RAAS system, the renin-angiotensin and aldosterone system. So these are all hormones that help us coagulate. They help us they help our blood pressure increase for lots of different reasons for encountering danger. They make us cortisol. The increase in cortisol creates glucose. It makes us more insulin resistant. And these all draw inflammation to our vascular system. And when we go through that over prolonged periods of time, it slowly erodes that system and makes it more prone to the deposition of lipid molecules that form plaques and calcifications.
It has an impact on a lot of our lives. It obviously has a really negative impact on heart disease. Mm-hmm. It is extremely impactful on our mental health. Mm-hmm. It's extremely impactful, I think, on just how we feel generally, whether we have energy or we don't have energy. Like stress has such an impact on
quality of life,
on your quality of life. Yeah.
And we live in such a high-paced society, right. Where we're constantly exposed to screens and information, and there's constant stimulation to our brains, and there's so much more that's expected of us on a day-to-day, hour-to-hour basis.
When you have the stress of life, right? You're going to have tough days at work. And now we've added the extra stress of a bunch of extra screens, like nonstop bombardment
all
of
the information you have to keep up with.
Yes.
And it's not just stressful. It doesn't just affect our emotions. I don't want to downplay that effect, but it actually has an impact on our biochemistry.
Yeah, it really does have a huge impact. So we've kind of talked about sleep. We've talked about metabolic syndrome, which kind of goes with our diet, our, whether we're overweight or not underweight. I kind of fit in that same category. I think exercise is also part of that. So whether we live a sedentary lifestyle or whether we're doing some sort of exercise, I think we have to touch on smoking. I think if you don't know that smoking is bad for you at this point, you have had your head in the sand, because it is probably one of the easiest ways to
first thing that's got to go.
Your health is to quit smoking. Like there just is no benefit really in the scheme
and that includes
of health.
Vaping.
Yes.
Period.
Yes.
The end.
Yeah. So vaping is not a substitute that is healthy for you. But if you were to pick actually probably the number one way to reduce your risk of cardiovascular disease, the first one would probably be quit smoking if you're a smoker, or quit vaping if you're doing that. The other one on there is genetics. And
Mhm.
unfortunately, that one we don't have a lot of control over. We were given genetics and that's how it is. So that is, I think, just something to consider. Um, and, we're not trying to fear monger
Mm-mm.
anyone. I just think it's important to be aware that this is a problem. This is something that every person should at least have in the back of their mind because if you do, you can do some things to help
We can do a lot of
decrease
things.
the risk,
Yeah,
right?
we've got really good technology and lifestyle interventions to help people who have increased risk for, genetic reasons.
Yeah. So since we're on this topic,
Yeah.
now that maybe someone's thinking about it, what kinds of tests would be recommended or what kind of an evaluation would you
Mhm.
recommend for someone to see, hey, what is my risk of cardiovascular disease?
Yeah, it's important to look at family history. People who have had cardiovascular events at young ages. So men or women, it's important to take a thorough family history. And then when we do comprehensive blood work to make sure that we're testing for genetic markers, I think probably the most widely tested and effective genetic marker is the lipoprotein A. So AP little a. There is a difference between
Yes.
LP
Big
capital
A
A.
and little a.
So it's funny when you hear people refer to it as LP little a. That one and probably the ApoE genetic mutations.
Hmm. Yeah. So if you're talking genetics, that one I think is around 20% of the population
Yeah.
has the APO little a. And that's a 3 to 4 time risk
Hmm.
increase for heart disease. So it's a pretty big deal. So if you have that, I think
And we can
it's a
easily tell
really
you if you
good,
don't know.
right. It's a really good motivator to say, okay, I want to do some things
Hmm.
in my life to mitigate that risk. We've done studies in medicine, like what points in life do people actually change their behaviors? And one of them is after having a heart attack. Well, I'm hoping we
Yeah.
can say, hey, you're at a super high risk of a heart attack. And then that can be a helpful motivator to say, I want to make some life changes.
Yep.
And so, I think getting the information that says, hey, you have a 3 to 4 times risk of having heart disease over the general population would be a pretty beneficial motivator to say, okay, I think it's worth maybe changing some things in my life.
Yeah, and they don't to dramatically reduce your risk, sometimes those changes are actually small and simple. Changing your diet so you're eating more whole foods.
Right.
So that you're getting fewer processed foods that have, artificially hydrogenated oils and fats
Right.
in them.
Right.
And increasing the amount that you strength train. For 20 minutes 3 times a week actually makes a big difference. And it is a
Yeah.
small amount of time.
Yeah. If you can increase your muscle mass and decrease your body fat percentage, it can actually have a pretty tremendous impact. I think
Yes.
like it was almost like every 1% above the recommended body fat percentage you have was like a 7% increased risk of heart disease in one of the studies they did. So it can actually have a pretty dramatic
Yeah,
impact.
it can, and I think there's this idea among the general population that in order to do that, you're gonna have to buy a gym pass, and you're gonna have to spend an hour a day, and, I just don't have
I'm
time
gonna
for
have to
that,
look
and
like
I
Arnold
don't have the
Schwarzenegger or
money,
it's
and I
hopeless.
don't and it really is far more simple than that, and there are so many resources available to help people with these things, and you don't need to make it that complicated. Small changes in your strength training regimen or including a small strength training regimen can make a very large impact on this. And it's something that we can track these markers. We can track your lipid profile, your ApoB. That's another laboratory test. It's not a genetic marker, but it's an important laboratory test that is a good determiner of cardiovascular risk. And we can do a lot of lifestyle things, small lifestyle things that make a big difference. And then for people who have significant genetic risks, we actually have a number of medications and nutraceuticals that can dramatically decrease the risk on top of that. And many of them that have really favorable side effect profiles.
Yeah. So I think if I was to recommend, I would recommend to everyone, at least at some point, probably reasonable in your 40s or 50s. If you wanted to go earlier, that's amazing. But at least in your 40s or 50s, to have some sort of cardiovascular risk assessment. And that's something that I feel would require an appointment that you can go through your family history, that you can go through things like what stress level are you dealing with, something where you can actually measure your body fat percentage, something where you can get a pretty good laboratory panel that's going to look at some basic labs that have a pretty good indicator of, do you have an increased risk of developing heart disease? So you mentioned ApoB. That's surprisingly taking a long time for
to catch up in the medical
the
community,
medical
even
community.
among cardiovascular specialists.
Right. It's surprising that you
Mhm.
still find people aren't. It's a simple lab. Like almost any lab can do it.
I have patients that have seen a cardiologist, and I review their labs, and they've never had an ApoB or an LP(a) tested.
Yeah. What's an ApoB? Maybe help
Yeah,
explain what that is.
apolipoprotein B, it's a component of an LDL molecule that makes it more likely or able to actually lodge into that epithelial layer of your vascular wall. So it is the marker that is the most indicative of the accumulation of plaque. So when your ApoB is high, it's actually more concerning to me than almost the rest of your lipid panel. But it correlates very strongly with an LDL. I think the problem with the measurement in the LDL is that most labs, when they calculate an LDL, it is that. It's not a direct measurement. It's a calculation based
Right.
on other measurements. So it's not as accurate as measuring the actual ApoB.
When people hear cholesterol, there's like, oh, cholesterol is what causes heart disease. Cholesterol is bad. I'm like, well, not all cholesterol is bad. Like cholesterol is actually used by the body to do a lot of things. It's what we make our hormones with. It helps with the building blocks of our cells. Like it's a big part of like us having normal functioning
Nutrient
bodies.
transport,
Right.
really important for your brain.
Yes. So the cholesterol in your brain actually helps you think, and so which will be interesting for our discussion about some of the medications for high cholesterol.
Yes.
So trying to say which cholesterol is the bad cholesterol, which is the one that's going to cause me to have a higher risk of developing heart disease. That is the idea behind, I think, the ApoB test, is saying, okay, is this level high, the one that we're most worried about? Now, granted, heart disease is multifactorial. And so just because your ApoB is okay doesn't mean everything's okay. You can do whatever you want, not exercise, smoke, and you'll be fine. Like that is not how this disease happens. This disease probably happens with a combination of factors. So this is one spot that you can check. And we still want to hit on other parts of life that are going to help decrease your risk of cardiovascular disease.
Yeah, I always tell my patients, I can recommend supplements and I can give you prescriptions for medications, but if the pillars of your health are not in order, they're really not going to be very effective. If you're not exercising, you're not eating well, you're not sleeping well, you're not managing your stress, you don't have good stress management strategies, and you've got poor relationship qualities in your life, and I always emphasize that includes your relationship with self, your mental health. I can give you medications, but they're probably not going to be very effective because the underlying cause of the inflammation in your vascular system lies in those 5 things.
Yeah. Are there any other tests that you typically would recommend to someone, especially if you think they may be in a higher risk category, especially genetically, besides just doing that basic lab panel and kind of a
one of
history?
the more widely available and cheaper tests that's available is a coronary artery calcium CT. And I mean, I know one of the hospitals by us, you don't even need an order for it. You can just schedule it and it's a flat rate, $69.
Yes.
And
I'm getting one of those next week.
Yes. It's about time. And it will measure the calcifications in your coronary arteries. Now, that's useful, but I think it's important to remember sometimes, too, that once those plaques have calcified, it's actually evidence of really prolonged plaque buildup. That's actually an advanced development. And those are the ones that are the most stable and least likely to rupture. So it's a good test that's cheap and widely available. But sometimes in people who have a normal coronary artery CT score that have significant risk factors, I like to get a CT angiogram, which will be better at picking up the earlier development of plaques and those plaques that are more likely to rupture.
Yeah. So two kind of more, I think are becoming more and more used tests for sure. I think a lot more people
Mhm.
are doing the CT calcium score. And if that's elevated, that's a pretty strong indicator that you're headed down the path
Mhm.
towards cardiovascular disease. And just to kind of quickly summarize, like, how that process happens is I think a simple way to look at it is basically you get a sticky type of cholesterol that's sticking to somewhere in one of the blood vessels in your heart, which is what we're worried about right now. Your body recognizes it and says, oh no, there's something there that shouldn't be there. And it tries to dissolve it or get rid of it. And that creates kind of an inflammation area that your body tries to cover over and form this plaque. As time goes on, that sometimes develops some calcium deposits, which are what show up in that CT scan.
Mhm.
Um, as that gets worse and worse over time, is that buildup is basically what is narrowing the blood vessel. So the more severe that is, the higher your score is going to be on that test. So it's kind of a very simplistic way of trying to describe how cardiovascular disease happens, but hopefully that is helpful in understanding like what
Yeah.
it is we're actually testing. Okay, so let's say I come in and see you and you say, wow, your ApoB is really high, or you've got a strong family history or both. So now what? I mean, I think this is where the important part, this is the most important part of this, I think, is now what? Now what do I do?
Yeah.
So like kind of what's the next step after you have somebody that comes in and says, hey, I've done all this tests, you show me my labs, it shows that I've got some pretty obvious things that are increasing my risk of cardiovascular
Mhm.
disease. Where do I go from here?
Yeah, so I think one of the first things that I do is, address foundational life practices, and usually there's some things we can change. We talk about muscle building, strength training. We talk about ways that they can change their nutrition. We talk about ways that we can improve their sleep and sleep quality. But I think one of the most difficult scenarios that I run into are people that are really, really discouraged because they're doing really well in all those things. They consider themselves to be a pretty optimized individual. They exercise regularly, maybe more than most. They have a personal meditation practice for stress management. They sleep well. They eat really well, and yet they still have this ApoB score that's off the charts.
This is feeling personal. Just so
um,
you know, I just had an assessment and I'm kind of fit in this category. I work really hard at my diet and my exercise, and I do have stress relief practices. Like I feel like I do a lot of
yeah.
these.
Well, and one of the most difficult populations I work with are healthcare providers, right? Because they're doing everything they know they should, but
Right.
also are more likely to be awake at night and
That is true.
have really stressful jobs.
I can't say my sleep's perfect.
Yeah. Well, I mean, you're an OBGYN, those babies come when they come.
They do. They do.
And so there's a lot of that and a lot of those risks that there's nothing we can do about. Like you're not going to find a new job at this point. And I have
Right.
patients who have really high stress levels, and there's nothing they can do about it. Their spouse had a stroke, and they're their primary caretaker. They have multiple adult children with special needs. There's only so much they can do, and so then we talk about different supplements that can reduce their risks, and we talk about pharmaceuticals, and the different target ranges that we're going to try to keep their blood work in. I like to see homocysteine levels, and this is another cardiac inflammatory marker,
Mhm.
below 8, and I like to see their hemoglobin A1C, which is a risk factor for diabetes, but definitely increases your risk of cardiovascular disease. I like
Yep.
to see it below 5. I like to see their ApoB below 70. I like to see, all these different target ranges that we're trying to get to, and we can use pharmaceutical drugs to help them reach those goals when we've exhausted all the lifestyle modifications that are possible.
Yeah. And I think that's probably one of the most important things is it's not a one size fits all. It's
Mhm.
a let's see what's going on with you personally, individually, and
Mhm.
individualize your treatment plan
Mhm.
to what best fits you. I think, and I've said this before, I think one of the disadvantages of how our country practices medicine is we kind of try to come up with a standard for everyone. And it's kind of this low cost, try to get the highest impact with the lowest cost and just apply it across the board. And I think it's a real disservice
It's a
to patients.
huge disservice.
Um, I have a really good friend who had a heart attack in his mid-50s.
Mhm.
Super active. He actually had a pretty healthy diet. His wife's a nutritionist. She's a fitness instructor. Like, he's eaten well. Um, I mean, he's normal, has normal stress, like I think normal part of life, but not a super strong genetic predisposition, but had a widowmaker heart attack in his mid-50s. And he went to his cardiologist, and his recommendation, after luckily they were able to save his life by doing surgery, was take this statin, which is a medication that lowers cholesterol. That's a very common medication given, and try to follow a Mediterranean diet and call me when you have your next heart attack. That was it. That was the extent of his counseling.
Yeah. I've had a number of patients come to me, and I've been mortified at the kind of counseling that they've been provided, or that have seen specialists or their primary care and really only had basic labs done. And when we look at a more comprehensive lab panel, I see that they've been pre-diabetic for maybe the last decade, and that this is a very metabolically driven, so it's important to look at cholesterol, because, those are the components that are embedding in the vascular wall, but we need to look at all the components that are damaging the vascular wall so that
Right.
they can actually embed there and form plaques and calcifications. And there is actually a lot you can do to prevent that, to detect it early, to prevent it, and then to actively manage that rather than just sending people home with this fear of their next life-threatening event.
I think sometimes because it feels like it's, heart disease is out there, that people almost feel like it's hopeless. There's nothing I can do. I can't reduce my risk. My dad had a heart attack. My, grandpa had a heart attack. I'm getting one. And I think sometimes people feel almost like there's nothing they can do. And the reality is there are actually some great options therapeutically, and both with your lifestyle modification and with some therapies that really aren't that hard to do, that can have a dramatic reduction in your risk of heart disease. And
Mhm.
and so I think it's actually worthwhile to go get checked out and to
Mhm.
find out, because we can do some things.
At
This is
very
an area.
early ages
Yeah.
too. People really struggle with the idea in their 20s that they might be mortal at some point. But, getting in early, and getting screened is really beneficial.
Yeah. I mean, I feel like I can't always control whether someone's going to get cancer. Um, this is actually an area where I feel like we can actually have a
Yes.
pretty dramatic impact on when you have heart
We
disease.
have very good screening tools, and we have very good treatment options.
Right. So I feel like it's worth it. Like, don't say, oh, it's hopeless. There's nothing I could do. I'm going to get a heart attack. I think say, wow, this is something I should actually maybe find out if this is a risk for me. And then these are some options. I think one question I would ask, are there some supplements? Like, there are medications, obviously, and
Mhm.
you would want to go and get evaluated and probably put on those medications if they're necessary. But there are some supplements that aren't even requiring a prescription that might be worthwhile
Mhm.
as well to kind of look at.
I think the big one is fish oil. Fish oil actually
So
has
easy.
enormous amounts
Yeah.
of
You can get
evidence.
it so cheap.
Yeah, it's cheap. Probably especially if you have significant risk factors, probably at higher doses than most people are taking. Somewhere around 3,000 milligrams is probably what they would need to be taking. There's also prescription strength fish oil supplements,
Oh.
so that are really
You
effective.
can't just take more fish oil
You
supplement.
you can. Um, but some people like to geek out on
Prefer
this kind of
with
stuff.
one pill. That's fair. That's
Fish oil
fair.
is really good. Anything that optimizes your metabolism. So I know like a microdose of a GLP isn't a supplement, but it is something that helps reduce the lipid signaling in your
Definitely
blood.
affects his insulin
And
resistance.
insulin, yeah, the insulin resistance and inflammatory cytokines.
Inflammatory,
So,
yeah.
for some people with a lot of risk factors, just a tiny microdose is useful. CoQ10 is another good one, especially for people who have already been prescribed statins.
Yeah.
That's a good one. Ubiquinol
And
is
especially I think almost uniformly that's recommended now if someone who's had a heart attack. So
yes.
a CoQ10 supplement.
Yeah. And I like using ubiquinol just because it's the active component of CoQ10. So it's a little more direct, the supplementation there.
Yeah. Yes, I take both of those.
Good job.
And then I mean, I think it's at least worth talking about statins because that's probably the number one prescribed medication for whether someone's had a heart attack, whether they have an increased risk of heart disease, whether they have high cholesterol or high bad cholesterol, I would say.
Yeah.
Statins are probably the most commonly prescribed medications. Been around for a really long time. They're generic. They're cheap.
They're prescribed like candy.
Prescribed
Yes,
like
they are.
candy, yes. And I think statistically they say about a 30% reduction in your LDL cholesterol from taking a statin. Pros and cons, I guess. Let's ask that question.
I know that it's so widely recommended in the medical literature, but I'm somebody who's actually really, really hesitant to prescribe statins just because of the side effects.
Yeah.
The side effects on muscles can cause a lot of muscle aching, difficulty building and maintaining muscle, and the impact that has on your overall health is a really big problem for me. And there is an increased risk for diabetes and metabolic syndrome.
Yes.
Which seems counterproductive to me.
Yeah. And I think the other one is we know statins do cross the blood-brain barrier. And so there has been some concern about its possible impact on dementia, Alzheimer's happening earlier. Some people reported brain fog.
A lot of brain fog on statins.
So there are some negatives. I think when you look at the studies, they're not overwhelmingly saying this causes this or this or this or this. So I'm not telling anyone to go off their statin that they're prescribed by their provider.
Absolutely not. I'm not going to get involved there.
No. I just feel like there are some new medications that are really good.
And I feel like statins are being prescribed without talking about lifestyle modification.
Yeah.
Not in any significant way. But without that blanket statement where they say, well, you should exercise more and eat a Mediterranean diet. And then they leave the room.
Right.
And I think there's so much more to talk about.
Yes.
So yeah, some of the other medications, they use different mechanisms of action, right? Some of them prevent the absorption of lipids in the intestinal tract. Some of them help you excrete lipids more effectively. And some of them help prevent the synthesis of or the making of lipids in the liver. So I do the evidence for ezetimibe and PCSK9 inhibitors are actually really good with far fewer downstream negative side effects.
Yeah, I think over the next 10 years, those are going to probably take over our therapy as our mainstream medicine kind of realizes and starts jumping in. It is a frustrating part of mainstream medicine is we are very slow moving and that can be, I think, discouraging for patients sometimes. It just takes a long time before providers are educated on new.
Yeah, the recommendations from our professional organizations change. We're already 1 to 2 decades behind what the actual literature and research says.
Right. So it can be very frustrating. But I think it's exciting that there are some new options that hopefully have some less side effects, but it's very, very effective. I think the PCSK9s are almost a 50% reduction in bad cholesterol. So I think that's pretty exciting.
And for those people who have significant genetic risk factors and optimal lifestyle, those can really save their life.
Yeah. I mean, if you start something like that, before you have a heart attack, you may not be having a heart attack.
Before you actually have significant plaque and, vascular calcifications.
Yeah. So this is one that if we can change the paradigm from reactionary to, oh no, you've had a heart attack, now let's do this, to, hey, you've got these things that put you at an increased risk of developing cardiovascular disease. Let's do this, and this, and let's push that clock back 10 to 20 years. Let's let you be there for your grandkids when they graduate. Let's move that so that you can have, those extra years where you're functioning at still a high level. And I mean, I think for us, we're very passionate about trying to improve the overall quality and health of our patients. And I think any provider really is. If you get into medicine and you're not passionate about helping people have a better quality of life, I feel like, what are you doing? I just feel like maybe in our mainstream practice, we're just a little slow sometimes to get to the preventative side of healthcare. And maybe we just don't have time with people, or
it is a big problem, or the education, or the the focus on pharmaceuticals without a focus on lifestyle intervention or early detection.
Yeah.
I mean, how lucky is it that the leading cause of death worldwide among women and men is actually something we have really good early
Options for it.
detections,
Yeah. And
early
options.
detection tools and
Yeah.
treatment options for.
Yeah. And don't wait. Like, I think
There's
don't
no
wait.
excuse for us not intervening and preventing, at very early ages for the leading cause of death when we have so many tools available.
Absolutely. So hormone replacement therapy for both men and women, because for men, testosterone is going to increase their lipid profile as well, increase energy, increase muscle mass, decrease metabolic syndrome. So there's a lot of advantages, despite also probably having improved energy, improved ability to recover from when you're exercising or working out. So there are actually a lot of benefits for men.
Yeah.
But yeah, let's maybe talk a little bit about the benefits of hormone replacement therapy and heart disease.
Yeah, well, as the most recent statement by the HHS, the Health and Human Services Department, says when the FDA removed the black box warning, hormone replacement therapy with bioidentical hormones is now known to decrease all-cause mortality, and that includes a 50% reduction in heart attack risk. So it improves outcomes for
50%. That's a big number.
That's
not a little bit. That's 1 out of 2.
I mean, in addition, it also, there's like a 64% reduction in cognitive in the cognitive decline and 34% reduction in Alzheimer's dementia. So these are huge, huge benefits.
Yeah.
Not to mention, as women are transitioning through menopause, you can sleep at night and you don't have huge mood fluctuations and your brain's functioning like it did when you were younger. And all the benefits that come with quality of life, but also reducing risk of all-cause mortality.
Yeah. And we've also, like I said, found that on the male side, it's beneficial. I think probably one of the really important things to note with that is the onset of that therapy, kind of we talked about before. Interestingly enough, the Women's Health Initiative study was designed to try to prove that hormone replacement therapy decreased the risk of cardiovascular disease. Like that was like their primary goal. They were trying to prove it. The problem was they didn't do a great job of stratifying their patient age. And so the older you get, the benefit of hormone replacement therapy initiation decreases the benefit of...
because a lot of the damage has already been done.
Right. So if you are 45 and get started on hormone replacement therapy, the amount of reduction in cardiovascular risk is going to be dramatically improved over if you're 70 and get started on hormone replacement therapy. Is that fair to say?
That is very fair to say.
Yeah. So both your brain and your heart, unfortunately, the damage gets done at that kind of early transition phase. And so the protection of being on that hormone replacement therapy is kind of lost if you wait too long to initiate therapy. So don't wait is basically what I'm trying to get behind. Don't wait till you're 65 years old to start doing hormone replacement therapy to help
don't let
protect
the
your heart.
Yeah. Of that widely publicized study get you back.
Get you down.
Hopefully the removal of that black box warning is really going to
I think we're catching up.
Improve the rate at which people are going to be seeking care and complying with care.
It's slow to adopt, but it's coming. I still feel like I have colleagues that even as late as last year were hesitant to put women on hormone replacement therapy.
Now it is really easy for us to get more paranoid about things and really hard for us to get less paranoid about things.
Yeah. And we move slow. And I get it. I understand that, especially our medical boards are very hesitant to make recommendations. I think a lot of it stems from medical malpractice and legal concerns. And the reality is we are starting to get to the point where we're seeing the benefits and trying to change that. And it's just a slow process. But we're getting there. And so that's exciting.
And now there's starting to be more of a focus on hormone replacement for men. And, they're kind of the next up and coming. Yeah. The older men have been forgotten. And, we're starting to focus on their cardiovascular health and their hormone health with appropriate ranges.
Yeah. I guess one last thing would be, are there resources out there that, people can get more information about heart disease or about benefits of therapies for heart disease that you find helpful that you recommend to people?
I mean, the American Heart Association is a good one. I don't know how many of the professional organizations do you feel have like the most up to date information on lifestyle and
Yeah, that one's good. You know, I feel like that's actually a really good option. You know, for me, you know, there are some new, pretty good medical evidence based podcasts out there that I think are actually doing a pretty good job educating. I know Peter Attia has got people on both sides of the fence on what they think about how he practices medicine, which is fine. I do think he does a decent job of explaining cardiovascular disease. He's got a really good podcast
I do.
on
It is
on
dense and
cholesterol.
it is long,
It's a little
but
medical heavy,
I do think it is more advanced in the
right?
way that it addresses the issue with the latest evidence. And I do think he's very careful about how he presents evidence without over
Right.
sensationalizing.
Yeah, no, I agree. He does have some really great experts that come on. I've had some success with the Huberman podcast as well, with
Hmm.
especially with some of his lifestyle modification
Yep.
podcasts that he's had. So there's information out there. I think my recommendation would be if you are, I would at least say in the 40 to 50 age range, getting a baseline assessment with a provider on your risk of cardiovascular disease makes a lot of sense.
Yeah.
And that's probably where I would push people to say, hey, go get,
At the latest.
yes, go get at the least amount, go get a good history,
Hmm.
go talk about your life and get some baseline labs and see kind of where you are risk
Where you
wise.
need to go from there.
Yeah. And then from there,
Hmm.
you can get hopefully care that optimizes your ability to reduce your risk of heart disease.
Absolutely.
Yeah, and obviously, you know, we are not your healthcare providers. We do recommend that you see a healthcare provider to get medical advice. Nothing that we say constitutes medical advice to you individually. We do hope our information is educational and motivates you to see a healthcare professional.
To actually seek that provider relationship.
Okay. Well, thank you so much for your time. Have a great day.